Oral cancer doesn't always start with pain. It doesn't always bleed. And by the time it does, it's often no longer in the early stage. That's what makes it dangerous. Hi, I'm Dr. Vikram Singh, oral and maxillofacial surgeon, and in this video, we are here to help you recognize the early signs of oral cancer, learn how to do a basic self-check at home, and understand when it's time to see a specialist before it's too late. We tend to think of cancer as something that affects the lungs, the liver, or the brain, but your mouth is just as vulnerable. Oral cancer can affect the tongue, cheeks, floor of the mouth, gums, roof of the mouth, and even the lips. It's more common than people think, and in India, it's one of the leading cancers in men. The tragedy? Most cases come to us late, not because treatment wasn't available, but because the signs were ignored and misunderstood. So let's start with the early signs. These are the red flags that shouldn't be taken lightly, even if they seem small. A sore or ulcer in your mouth that hasn't healed in more than 2 weeks. A white or red patch on the tongue, cheek, or gums. A lump or thickening inside the mouth. Numbness in part of your tongue or lips. Difficulty chewing, swallowing, or moving your jaw. Persistent hoarseness, bad breath, or an unusual taste that doesn't go away. Now here's the most dangerous symptom. A painless ulcer that refuses to heal. Pain usually shows up later, but early stage oral cancer can be completely silent. That's why regular self-examinations and clinical checkups are so important. So how do you check your mouth at home? It only takes 2 minutes. Stand in front of a mirror with good lighting. Open your mouth wide. Look at the inside of your cheeks. Do you see any unusual patches? Use a clean finger or tongue depressor to gently lift your tongue and check the underside. Feel along the sides of your tongue for any hard areas or small lumps. Tilt your head back and look at the roof of your mouth. Feel along your jawline and under your chin for any swollen or hard lymph nodes. If you spot something unusual, it lasts more than 10 to 14 days. Don't wait. Get it checked. So who should you go to? This is where oral and maxillofacial surgeons come in. As maxillofacial surgeons, we are specially trained in diagnosing and managing tumors, cysts, and suspicious lesions of the face, jaw, and oral cavity. We don't just treat, we investigate, we perform biopsies, interpret imaging, and work alongside oncologists when needed. From identifying early stage leukoplakia to managing advanced squamous cell carcinomas, OMFS plays a central role in both diagnosis and surgical management. Sometimes early stage lesions can be removed completely with a small excisional surgery. In other cases, we coordinate with cancer teams for advanced treatment, including radiation or chemotherapy. But the key message I want to leave you with is this. Oral cancer is treatable, especially when caught early. Let's also talk about risk factors because awareness is the first layer of prevention. The most common cause in India is tobacco in any form, smoking, chewing, or gutka. Add alcohol, poor oral hygiene, ill-fitting dentures, and HPV infection to that list, and the risk increases even further. If you fall into any of these categories, you should get screened at least once in a year, and even if you feel completely fine. And here's something we often forget. Oral cancer doesn't just affect older men or tobacco users. It's being seen more often in younger, non-smoking populations too, especially due to HPV, human papillomavirus. So don't rely on the assumptions, rely on screening. One of the biggest mistakes people make is waiting for the lesion to hurt. It's just a small patch, doctor, it doesn't bother me. That small patch might be a precancerous lesion. That tiny ulcer might be the start of something more. And every day you delay treatment, you allow the lesion to grow deeper, making surgery more complex and recovery more difficult. As a surgeon, I've operated on patients who told me they wished they had come in just 1 month earlier because in that 1 month, things changed, sometimes irreversibly. That's the cost of delay. So if you or someone you love has an ulcer that won't heal, a patch that looks odd, a persistent swelling, or a nagging feeling that something is not right, don't wait. Get a clinical evaluation, get a biopsy if needed, because when it comes to cancer, early detection doesn't just improve survival, it improves quality of life after treatment. If this video helped you recognize the importance of oral cancer screening, share it. It could literally save someone's life. And if you have a question or want to know more about how we evaluate suspicious oral lesions, drop it in the comments. I'll take it up in the next video. Remember, your mouth speaks for your body. Listen to it before it goes silent.